Hi, good evening. Myself, Dr. Ameer Theruvath from Hospital, Kochi. Firstly, many thanks the organizers of this conference for giving me this opportunity. My topic is the use of expandable interbody cage in MIS TLIF, whether it is good or bad for the patient. Now, we all know that MIS TLIF has got many advantages compared to its open counterpart. And I started using the interbody expandable devices once I had a few issues with the conventional static cages when I started my MIS journey. I had two instances of suboptimal cage placement and a few couple of cases of cage back out. Even though they were only radiological issues, I had to keep these patients under strict follow-up to make sure that they don't develop any instability or neurological deficits. That's the reason why I ventured into this expandable device in the hope that I would be able to maneuver the cage to my position of choice, and also the distraction might help me get a firmer grip on the interbody to prevent the incidence of back out. So I was very happy until I had this case, this 69-year-old lady with back pain radiating to both legs, typical grade 2 bar 3 light spondylolisthesis with significant neurological claudication also. This patient was treated by MIS TLIF, expandable cage. Surgery went well. First post-op day, she was mobilized without any issues. But on the after around 48 hours of surgery, she started having severe back pain with radiating pain to both the lower limbs, which was so severe. So it's not responding to any medications. So I took her for a CT, which showed significant subsidence of the cage into the L5 end plate. And the axials, the SAG images showed that the subsidence has caused TLIF side foraminal window to remain patent, whereas on the other side, we supposedly got a indirect decompression causing the freeing of the corresponding nerve root that has been completely lost. So what happened is that after the patient was mobilized, the cage sunk into the end plate to cause loss of distraction and the corresponding indirect decompression to be lost. And this patient, the pain settled after a week of bed rest and with narcotic patches, but she has to be hospitalized for many more days than was expected. Now, Pimenta has et al. A bit of theory. Pimenta has et al. Has given put forward these risk factors like female gender, age more than 60, spondylolisthesis, and scoliosis. One point given to all these factors, and if the patient has a score of 2 or more, the chance of cage subsidence need to be considered very, very high. Now, what I want to convey with this talk is that the expandable cages, they come with a lot of exaggerated utility. We know how careful we are when we do the conventional TLIF or open TLIF in osteoporotic patients. Even when you put the shavers, we try to be very slow and make sure that the end plates don't get tripped off by the shavers. So when we use these expandable devices and when we expand them, some of these cages they can be expanded 6 to 8 millimeters, from 8 to 16, or from 10 to 14, like that ranges. These we don't really know how much of distraction needs to be given to get a firm grip. These all metal devices, they can really damage the end plates, causing cage subsidence. And we know that these interbody cages need to be placed under between two intact end plates to make sure that they remain firm. Otherwise, these plates can move around and cause instability, back pain, and even neurological deficits. The second problem is the graft holding is very limited in these devices. Even though the fusion occurs outside the graft more than inside, this property significantly limits the fusion area available in the body area. And higher cost involved and limited clinical data are also against the use of such devices, and of course the very high risk of subsidence. So what I want to put across with this talk is that while we use such devices, we need to take into account the various factors like the age of the patient, the bone quality, and we need to carefully judge the possible risks and the benefits involved with the use of such expensive devices before you actually employ them. Thank you so much.